too. Do you like it?
I don't know, you?
I don't know either.
Hello students, today we're going to practice CPR, cardiopulmonary resuscitation. It's an emergency procedure which is performed to retain the brain functions when the heart doesn't work. We use CPR for people who are in cardiac arrest to restore their blood circulation and breathing. It's very important that we all know how it works, not only nurse, but also every citizen in this country. We can save a lot of lives with CPR because there are at least 300 people a week who are suffering from cardiac arrest outside the hospital.
Well, I suppose you all want to know how it works, right?
Yes.
First, I'm going to tell you something about the chain of survival. First, you call for help, dial 911 when you suspect a cardiac arrest. For example, when the victim has pain on his chest. When the victim indeed has a cardiac arrest, you start compressions. So you start with CPR. Then, if possible, you use a defibrillator. And last but not least, the victim has to go to the hospital as soon as possible. And sooner he gets specialist CPR, how better.
Well, now are you guys going to tell me what to do when I see a person with a suspect cardiac arrest? Crystal, tell me what to do.
You call 911.
Yes, indeed, but what if the person lies on a very busy street?
Make sure it's safe.
Yes. First, you make sure your surroundings are safe. You can't save anyone, and it's also life-threatening for you. When it's safe, you look at the victim response to your voice and touch him. And you check if he's breathing. If not, you ask a witness to stay with you, tell that he has a cardiac arrest, and you might need his help. You ask another person if she wants to get the defibrillator, and then you start the compressions. Make sure your hands are on the bottom of the sternum, and you give 30 compressions with a speed of 100 compressions per minute. Then you give 2 mouth-to-mouth inspirations.
Why do you have to ask someone if he stays with you? Can he help you with the CPR when you're tired?
Yes, for example, for everything you can't do alone.
Alright.
Are there any questions?
No, I think I get it.
No, me neither. I get it.
Alright, now I'm going to perform CPR on this dummy and you guys give me a comment whether I'm doing this wrong or right, okay?
Yes, I suppose.
You have to make sure it's safe. Then you ask for help.
No, first you have to shake the victim. No, not too hard. And ask if he can hear you.
Can you hear me?
Good, you forgot something.
What?
If he's breathing, you have to look if he's breathing.
Then you ask for someone to call 911 and if he wants to stay with you for help.
Call 911 and stay with me. Maybe I can use your help.
Yes. And then you ask another one to get the defibrillator.
You get the defibrillator and come back as soon as possible. Alright, you guys, you're doing great. Next.
You have to start the compressions.
Yes. 30, right?
Yes, with a speed of 100 per minute.
Oh, I didn't knew that. Did she told that?
Yeah, she did.
Oh, I haven't heard it, I guess. But I do know that after the 30 compressions you have to do 2 mouth-to-mouth ventilations and you start over again.
But do you have to start over and over again until you receive the defibrillator?
Yes. Until you have the defibrillator, you have to do the compressions over and over again.
Well, are there any more questions?
No.
Okay, then you are ready to practice yourself. Get a dummy. And it's time to start.
Do you hear me?
Stop! You forgot something.
Oh, sorry.
Yes, you have to look it safe.
Yes, alright. I look if it's safe. Do you hear me, sir? Do you want to stay with me? Or for help? Do you call 911 and get a defibrillator?
Good job, Melissa. Crystal, it's your turn.
to know how it works. Now I can help people on the street. When I see someone go down, I don't have seconds to help him.
And Crystal?
I also think it's interesting and very important to know, but I still think it's a bit scary to do this in real life. I don't know if I can do it. Maybe if I practice more.
Well, you can ask us to help you practice. I'm sure that you both will pass the exam.
Well, the lesson is over, but feel free to practice some more. And next lesson we're going to teach you how to use the demonstrator.
Thank you.
Have a nice day.